Record. All right. I'm going to pass it over to Nick and Riley from home base to get us started.
Perfect. Hello, everyone. My name is Nick Large. I use he, they pronouns. I am from an organization called Home Base. And so if some of you were here last year and then also the year before when we did our equal access training, you might remember me, you might have seen me before. Home Base is an organization that works around the country, but most of the time in the Bay Area and in California. We help communities build capacity to address homelessness. We work with them kind of addressing it in their local community in whatever kind of way they need. So a lot of times that'll mean helping with maybe project applications, helping with technical assistance, answering different types of, regulatory questions. Can I spend my money on this, on this? Is this compliant? Is this okay? And we also do a lot of trainings. And so that's why we're here today. I'm also joined here today by my colleague, Riley. And so, yeah, Riley, you want to introduce yourself?
Yeah, thanks, Nick. So, hey everyone, Riley Mia from Home Base. Pronouns are she, her. Yeah, you may have seen me on some other trainings here in Contra Costa or at the Council on Homelessness meetings or other committee meetings. So happy to be with you all this morning. And yeah, excited to get this training kicked off.
Great. And if we could launch our initial survey, that would be great. Um, and so as I'm going over the agenda for you here today, we have a little kind of like pre-survey, if you will. Just kind of asking you, what's your familiarity with equal access? Also asking you, what type of facilities or what kind of roles or projects, you all are coming from. So please answer this because this will help us figure out how many breakout rooms we need to. Because what we'll be doing later is, first we're going to go over some of that foundational knowledge, some of the terminology, what is the equal access rule? What does HUD say? Excuse me. And then we will be going into some different scenarios. So I will be sharing a public Google Doc link with you that I put all the scenarios and stuff in, and then we'll be throwing everyone into breakout rooms to kind of go over those. And then we'll be coming back together as a group to discuss them and talk about them. And also really quick, if you're not able to access like Google services or something, let me know in the chat. We have another like public link too, so I can just, straight up share a PDF with you if that's better, if that works. But go ahead and let us know in the chat if you're not able to access Google stuff. I know sometimes, government types aren't able to do that. But as we are getting the answers to these polling questions in, let me just go over our agenda with you today. So we're having our welcome and introductions. You met us, your home base staff, our lovely Contra Costa staff who is hosting us today. Then we will be going over some foundational language and history. So we'll be talking about some kind of basic fundamental terms, how we define things. I'm also curious to hear from all of you too, right? Because I'm not, the one arbiter on all of this terminology, on all of this information, right? There's a whole community of folks who have knowledge about these topics. I'm sure we have lots of people who are very knowledgeable about these topics in this room today. And so it's always interesting when we get to kind of hear from other folks in here, well, this is how I think about this word, or this is why I identify as this, or, all of that is always really interesting for me to hear. So we'll be going over that. I throw in to a little bit of history stuff. I actually have a background in history here in San Francisco, pretty familiar with some of the Bay Area history, some of the California history. So I like throwing that in there as well, because I know you all have to do this training every year. So we try and mix it up a little bit, throw in new information in there. I believe we also have someone from the Contra Costa Health Services Gender Clinic, Brooke, I think is here somewhere. There's a long list of people, but I'm assuming she's here somewhere. But she's going to be chatting with you about the Gender Clinic and a little bit of what they do, the kind of services they offer. Because, I think depending on where you all are at or what type of clients you have, you might have some clients who go to the Gender Clinic. I know last time when we did this, a bunch of folks did actually have a bunch of clients who went to the Gender Clinic. So you'll be able to learn about their service, learn some of what they can provide and what they can offer your clients, and we'll make that connection with you. After that, we will be going over the equal access rule. So what is the actual rule? What is the thing that HUD says that we all have to abide by? And then there's also a component of it that talks about how families are defined and this aspect of family separation, meaning when you have a family, you keep the family together, right? And when I use family, sometimes that's kind of interchangeable with household, right? So when you think about how you're entering folks into your HMIS system, right, you're kind of putting them in a household, you're connecting them to each other in that household. So kind of pretty similar. So a lot of these family and household things you can use interchangeably. And then after that, we'll be going into our breakout scenarios. Okay, Brooke is here. Perfect. Awesome. Um, and so I hope I've bought enough time for people to do this survey. I think we have, okay, yeah, we have about 94% of the people who have answered. So that sounds complete to me. And let's see, how do I see the answers to the other poll questions? Oh, wait.
You just scroll down.
I scroll, wait, hold on. Okay, I'm trying to figure it out. Oh man. Oh, okay, I got it. Here we go. Okay. So it looks like we have a lot of frontline staff here. We have a lot of management folks, people who are in leadership as well. So kind of a different variety of different roles, and of a lot of different facilities too. So we have a bunch of outreach staff. We have PHI, PSH, rapid rehousing, transitional housing staff, um, places, facilities that have common areas, congregate shelter, and then, some scattered site. Okay, so we have a pretty even distribution of different types of projects and different types of scenarios. And so as we go through the breakout scenarios, I kind of put little tags by them. So it'll say, oh, this is for shelter, this is for, shared facilities, this is for living facilities. So you can go and try and pick the ones that will be relevant to you. Okay, but with that, I think, how about we get started here? Okay. Okay, so first we're going to go into our foundational language aspect, just kind of going over some key terms. And as I'm going over with these two, feel free to chime in with the chat. I'm always curious, if people have different ways that they're thinking about some of these words, how you're kind of thinking about them and why, right? But the first one we'll go over is sex assigned at birth. So oftentimes this is called maybe just sex, right? You have sex and you kind of have gender, right? As two distinct separate things. We're kind of thinking about them here. So sex assigned at birth, meaning, typically what is assigned by some kind of doctor, medical professional, whatever. And often it's based on external anatomy, and it's typically assigned as male or female, right? And so that's, the kind of thing of what gets put on your birth certificate, right? And the thing about sex too, and this is kind of something that, especially with a lot of the recent news headlines, we kind of see, and that's been more of a conversation, right? Is biologically sex can be defined in a lot of different ways. I remember when I was watching all like the recent Olympic news, right? There was that boxer, or there were, I guess, a few boxers, and there were all these conversations. Oh, she's transgender, or oh, this is a man. They had all of those different news stories that were going on. And then you kind of through those different conversations, you would see about how each different person was defining sex in a different way, right? You would see some people, they would say, oh, no, well, the chromosomes of this person are blah, blah, blah. Therefore, they are blah, blah, blah. You would hear other organizations, they would say, oh, this person has like really high, this type of hormone level or this type of hormone level, and then other people would be like, oh, well, this person has XYZ physical characteristics. So therefore they have to be a woman or they have to be a man, right? But all of that to say that biologically speaking, there are a lot of different ways in which we might think of defining sex, right? Or we might think of contributing to the biological aspect of sex, right? And so that can be defined as a combination of hormones, it can be chromosomes, it can be both kind of internal and external reproductive organs, right? And different types of secondary sex characteristics. So that can be like breasts or things like that. But there's so many different ways that biologically you can define sex. That's why when all of these conversations enter the public sphere on trying to define who is a man, who is a woman, right? That's why it can get really tricky because it's not just one of those things, right? There are so many different aspects and there's so many variations within those aspects. And so when you kind of try and have these very two neat categories of male and female, you're going to have people who don't fit into those categories, right? So actually, my mom used to work at a special ed school. So it was a school entirely for special education. And it wasn't like, I have ADD. It wasn't like ADD type of special ed. It was like fetal alcohol syndrome type of special ed. And it was actually very common to see people who had like XXY chromosomes, right? As opposed to XX or XY, which you might think of as male and female. But all these types of different combinations, while not like 99% of the population, right? They're more like maybe 1% of the population, much less, but they do happen. So sex assigned at birth, the TLDR version, and gender identity. So what separates that from gender identity? So typically when we're talking about gender or gender identity, right, that is the internal kind of how the person identifies themselves. It's this kind of deeply held sense of who someone is, right? And that can be the same as the sex you were assigned at birth, right? It can be the same as what's on your legal documentation, your government paperwork, or whatever kind of medical documentation, or it can be different, right? And it's related to gender expression, but it might also be different than how that person is physically appearing or kind of expressing themselves in that moment, right? So related to gender expression, I think maybe a lot of people, how they identify their gender, right, will tie pretty closely into maybe how they're expressing their gender, but not all the time, right? Like 24/7, if I identify as, like I identify as gender fluid, right? And so for me, that means my gender, I think of it as being more fluid. The way I express myself in my gender is more fluid. Kind of what I look like day to day is more fluid. Right now, I have this like flannel like top on. It's because it was like what was at the end of my bed, and I'm not a morning person, right? But you see me on the weekend, and maybe I'll look pretty different, right? And so the expression is going to be very different. And maybe it'll align with the gender identity, but especially as you're working with clients, right? Don't necessarily make that assumption of what is the expression is the identity, because it doesn't always line up. But going into gender expression, right? So gender expression, you can think of these as the kind of observable manifestations of gender. So that can be like what someone is literally wearing, right? It can be like their clothes, like things like a haircut, how body language can be a really big one of these, right? All these kind of observable characteristics of gender or that have gendered associations. And the important thing to remember about gender expression, right? Yes, it can carry these connotations of masculine and feminine, but that also varies pretty substantially culturally, and it changes over time, right? Like we have to remember that even though we're looking on this with this kind of American lens, this American perspective, if I see like a skirt as being this kind of like feminine article of clothing, like that's not true culturally in a lot of other places, right? In other places, if I am wearing a skirt, maybe it's a sign that I am a warrior, and it's actually a very masculine expression of gender. If I go and I'm wearing a kilt, we might think of that as a skirt. Other people who wear kilts might not think of it as a skirt, and it might be a masculine expression of gender, right? And these things change over time too. So one of my favorite examples of this is with like high heels, right? We think of like stilettos and stuff, and high heels right now is like a very feminine expression of gender. But if you go back in history, who kind of when you first started seeing those become like a big thing, it was actually worn by kind of warriors when they would go on stirrups with horses. They were used to keep someone's foot in place as they would ride into battle. And so it was actually a very masculine expression of gender to wear these kind of like wedges or wear these kind of heeled shoes, right? Because it meant that you were going to go in and you were going to kill people, right? Maybe now people still have that same association with stilettos, right? Maybe. But again, right, it changes over time. And the last one here, sexual orientation. So sexual orientation usually describes as like, who are you attracted to, right? And sometimes you'll also see this broken down by who are you physically attracted to maybe who are you emotionally or romantically attracted to. So sometimes you'll see differences there, right? Because you have some identities where it'll be like, say, for example, like pansexual. Like I think a lot of people would probably define that something as like you're attracted to the person, right? So not necessarily the physical kind of aspect of something or the gender, but the person, right? Or maybe you may have someone who identifies as like gay, right? If you're like a cis gay man, it means you're a man who is attracted to other men, right? You're emotionally attracted, maybe you're romantically attracted, and all of that to other men. And when you're working with clients who might be trans or who might be non-binary or kind of however they're, identifying themselves, their sexual orientation, right, can be any of these things, any of the things you see in that long acronym soup. So any questions before we move on? Okay. Another thing here is I like to show this little gender unicorn. And so some of you, if you've done this kind of training before, if you've done this kind of thing before, you've probably seen either this or something that looks much, much like this, right? But I think this is kind of like a good physical or not physical, visual kind of depiction of some of these topics that we talk about, right? And so you have gender identity here. Gender identity, right? You have it the unicorn, it's kind of coming out of the brain, right? Because remember, gender identity is this kind of deeply held sense of how you identifying your gender, right? It's kind of that thing that's in your core, if you will. And when we think about all of these two, and when we talk about these identities, we talk about them as maybe on like a kind of like a spectrum type of situation, right? Someone's going to be from here, or maybe they're going to be here, maybe they're going to be here. If anyone has ever heard of like Kinsey, right? When we get down to this kind of attracted to part, Kinsey had the scale. So Kinsey was a very famous kind of like sex researcher, right? He published all of these works that were very kind of revolutionary and very kind of surprising to a lot of the American public at the time because it showed a lot of people have experiences with same-sex kind of partners more so than was thought of that had happened like in the general public. So that was kind of very big when it came out. And gender expression, right? We have all these little green dots around here because it's the kind of observable characteristics of gender. Sex assigned at birth, right? You have something, let's say, might say male, it might say female. And there are also lots of what are called kind of people who are intersex, right? And so again, right, we have a lot of variation in all of these identities. There's a lot of variation too of these different physical characteristics, of these different biological characteristics. So if you are someone who is a nurse, who is like a nurse practitioner or a doctor, works in the medical field, seeing someone who is intersex or having a client who is intersex is not super uncommon, right? It's maybe like what, 1 out of 100 people or something has some kind of intersex something going on. And so it's not like very common, right? But it's not something, if you are a medical professional, that you won't see over the course of your lifetime. Statistically, you're probably going to see it. And then we have attraction, right? So here in this kind of diagram, right, it breaks out physical and emotional attraction. So you'll have maybe some people who are physically attracted to maybe one gender, but then when they have emotional connections, they can have strong emotional connections to different genders, right? Maybe someone says they identify as bisexual and they have strong, physical attractions to men, but when they have like an emotional attraction, right, or this kind of romantic kind of attraction, right, maybe that's something they can have towards men and women. Any questions before I move on? Because I threw like a lot of information at you all. Any questions? Okay, and I'm going to start going a little, I think, quicker too. Okay, so some quick terms too. I wanted to throw some terms on here which maybe aren't as common, but I thought might be things that you might see kind of in your day-to-day work, or maybe in how your clients identify, or kind of some of the words your clients might be using, right? So you have this first one here is an acronym. So AFAB, assigned female at birth, AMAB, assigned male at birth. And so this is typically referring to what is the sex that was assigned at birth, right? So you might hear someone use this acronym. And again, after this, you're going to get all these slides and stuff, so you can kind of look back through them and you can see what's all here. Non-binary, sometimes you'll see people shorten this to like the letters NB, or it might be NB, but it means non-binary, right? So someone who doesn't feel that they necessarily fit into that men or women category. Transgender, trans, so you'll see it written in a few different ways. Typically, whenever you see this little kind of asterisk or this little kind of star next to every term, it's used to kind of connotate this and then other things, right? So it's kind of like a little catch-all, if you will. And a lot of times now, I think I see trans being used as like an umbrella term, right? So it'll be used as kind of a term. I think generally maybe where someone's sex that they're assigned at birth doesn't necessarily match with how they're identifying, right? And like maybe on intake forms, right, you might see like a trans option and then maybe options under that or something like that. Other words you might see kind of in your work, right? Transfem, transfeminine. I think people have a few different ways of spelling this. You'll also see like transmasc, transmasculine. So you might have clients who refer to themselves as transfeminine or transmasculine or something like that. Typically what that means is they're trans, but then on the feminine spectrum, or kind of on the feminine area, and masculine, but on the masculine area. Right. So I think that'll be a very common one if you're working with clients. I think a lot of people use that right now and how they identify. Gender non-conforming, also more of a descriptive term, right? Not necessarily a term that someone will say, I am a gender non-conforming person, and this is how I identify, right? So I feel like I used to see people sometimes identifying like as an identity, right? Like when we talk about non-binary, that's an identity people will have. People will say, I identify as non-binary, I'm a non-binary person. I don't feel like I see gender non-conforming used in that same way. And it generally tends to be more descriptive. It's just describing the gender expression of a person. And then I threw this acronym soup here at the bottom, right? So you'll see there's about 1,000,000 letters in these different ones that I did. And I just did that to kind of show that there are so many different variations of this kind of like, LGBTQ, all of these different acronyms. And I think one thing to remember about all of these is that they vary A, by time, and B, by location, geographic location. So this first one that I have up here, so LGBTQ, right? I think that's one a lot of people have seen: lesbian, gay, bisexual, transgender, queer. Sometimes the Q is used for questioning too. And then I, intersex, the AA, ally, asexual, GNC, gender nonconforming, the number 2 for 2, like literally just 2, and then S, spirit. So I think sometimes if you're working in a place, or there are lots of like communities of people who identify as Indigenous, Native American, First Nations, you might see the 2S here in that acronym. And so that's kind of a recognition of different types of Indigenous identities, right? This other one, QT BIPOC, so queer, trans, Black, Indigenous, people of color. So you've probably seen BIPOC, it's kind of like popping up everywhere now. But queer and trans are used kind of as umbrella terms to encompass aspects of sexual orientation and also gender identity. So they're used kind of QT as to try and encompass everything. And then BIPOC meaning an emphasis on queer and trans people of color, essentially, right? Other ones, you won't really see this one probably used as often, the GLBT. That's an older acronym. So it stands for gay, lesbian, bisexual, transgender. Fun fact, you used to see that a lot more. Like if you go to pre-80s, US history, you would see that a lot more. But post 80s and once the AIDS crisis started becoming a really big thing in a lot of communities, a lot of places switched the L and the G. And the reason was because they wanted to put recognition or give recognition to like a lot of the lesbians who are helping out the gay men during the AIDS crisis. Because what started happening in the initial kind of start of the AIDS crisis, right? You have to remember no one knew what was causing it. No one knew, oh, how is this transmitted? What's going on? And so there was a lot of stigma. There was a really high level of stigma to where you would just be declined for services. Like if people saw you had some of the visible symptoms of it, they wouldn't let you in, they wouldn't touch you, they wouldn't talk to you, they didn't want you to like spit on them or anything. And so post kind of 80s, a lot of communities switched the L and the G, put the lesbian first in front of the gay, to really kind of show both an admiration and also a critique, right? You hear this in a lot of different kind of social circles, right? Where it's like, oh, the men, are taking credit for everything. They don't give any credit to the women. So kind of aspects and critiques of kind of gender within the movement, but also in recognition that, okay, well, when no one else, when no other hospitals would, work with all these gay men who had AIDS, a lot of the lesbians stepped up, right? So that's a little bit of history there for you. Another kind of interesting or fun thing I tried to throw in here too are different kinds of cultural identities, right? And so, we think of gender and sexuality in one way here, kind of in Western society in America, but it's not thought of in the same way in other places and throughout history, right? And so actually, I recently watched this show on Netflix. What was it called? El Secreto del Rio, this like the secret of the river. And it was really good. It just kind of showed up on my Netflix feed. I was like, I had no idea what it was. I was like, let me watch this. There's a river, there's like murder. I'm into it. But it was talking about this kind of cultural identity, Mushe. So a recognized third gender among the Zapotec people in Oaxaca, Mexico. And so it was talking about these people who identified as Mushe. It was really interesting because it first covered the first half of the series was it through the lens of the characters, but the characters were children. So the first half is the characters are children, and you see how children talk about gender, right? And that's really interesting because when you hear, and I don't, if people here have kids, if people here work with kids, you kind of learn how much of what we know about gender becomes socialized over time, right? That becomes really apparent to you because these kids are asking questions that you in your mind might feel like, oh, you should know this, like gender is blah, blah, blah. Or if you wear a dress, you are a girl, But kids don't have that frame of reference because they don't have that socialization yet. And so it was really interesting watching this series because it goes through the eyes of the children. They're asking all of these questions. They're like, oh, why do you walk like that? Or girls walk do this, and then blah, blah, blah. And so it was a really cool series. So I definitely recommend it if you have Netflix. If you don't have Netflix, you could probably find it online. I don't know where, but I'm sure it's somewhere. But this is kind of one interesting identity I wanted to highlight. Other kinds of cultural identities, right? And there's like a lot more than this, but these are just some of the examples that kind of like popped into my head as I was putting this together. But Fa'afafine and Fa'afatama. And so these are two kind of Samoan kind of genders, right? So a third and a fourth gender in Samoa, kind of more fluid identities of gender, right? So not just like a third gender, but also a third and a fourth gender, right? So and this might encompass aspects of gender expression. It might also encompass aspects of what are the different roles of these genders or what do people of different genders do, right? So in some places, right, they don't even just have three genders, right? It might be four. Another interesting one, the machi. So a gender determined by identity and spirituality. So not necessarily by the sex assigned at birth, right? And in southern Chile, And so I thought this one was really interesting too, because it encompassed aspects of spirituality, right? Because I think we have to remember, here in America, right, when someone's born and the doctor kind of does your paperwork and all of that, it becomes institutionalized, right? It becomes written on the paper, that becomes that. But, other places, that's not included on your birth paperwork, right? That's not a foundational document for someone. And so it's kind of interesting to think about that. Um, any questions before I move on? Look at the chat here. Anyone want to know more about any of this? Anything you don't understand? Anything you're wondering? Okay. Yeah, I always like highlighting other examples because I think we get so Western centric that we forget that there are other ideas and ways people think about gender. And there are so many historical examples too. These are modern examples of how people today might identify, right? There are so many examples from throughout history too. Like you can look at old medical, textbooks. Like you can look at old medical textbooks from like India in like 1000 BC, and they have like 10 genders, And so this kind of notion that we say, you'll hear it, I mean, a lot in the media now, God created one man and one woman. And, some of these textbooks are before the time of Christ. So, you can say whatever, but, that's 1000 BC. Okay, let's go on. Okay, and so thrown in a little history here too. Okay. And so in a lot of places, in a lot of cities, you used to have different types of ordinances that would criminalize different aspects of gender expression, right? This is just a San Francisco example. I kind of briefly tried to look up some of the different like places within Contra Costa County. Usually these types of ordinances would have been done at like a city level. And so I started looking at it and like there were no big news stories or anything. So I know I would have had to go look in like city codes, and I was not about to look in all the city codes. So I feel like there were probably some in Contra Costa County. They were very, very common across the US. Um, they were common at different times, depending. So this one is from San Francisco. You go back in San Francisco's history, and San Francisco had like a lot of nightlife, a lot of entertainment. There were a lot of people who were essentially imported into the city for labor purposes. And so at some points, the city was like very, very male because it was all of these laborers or people who were imported to do work. And so it was like disproportionately male. And then at other times, that kind of changed or maybe evened out a little bit where it was maybe like 50-50 or kind of whatever it was. But because I think of how gender in San Francisco played out, you had all of these kind of laws that happened at earlier times than a lot of other places. So it's an interesting example. You can see this one is from 1898 when it was kind of originally written. I think there was actually one that was before 1898, but this is the revised one. But it's essentially saying like, if someone is wearing something that is like offensive or doesn't match your understanding of what their expression should look like a lot of these ordinances really boil down to, does what's on their government or legal paperwork match how they are expressing themselves by your definition, right? And these are actually on an uptick now. So you have a lot of cities, a lot of places now that are putting these back in place, these kind of municipal ordinances that say, you see a lot of them against drag queens now, right? It'll say like, oh, if you're wearing this article of clothing or if you're doing this, that's indecent. And then you have to think, well, who is defining what indecent is, right? All of those kind of things are making a little bit of a comeback now. And so too, this is an important context, right? Because as you're working with your clients who might identify as trans or non-binary or, whatever it is, that's what they're hearing about like day in and day out, right? They're getting all of that news cycle kind of come in. They're hearing about, oh, in Tennessee, there was this ordinance where they banned this in public, or in here, there was this place where they banned this. And the thing is, too, and this has been true throughout history, this is true with this kind of ordinance, oftentimes when some of these are passed, it impacts or it has the potential to impact more communities than who they were initially targeting, right? And so when we look at some of these kind of like, they have the drag bans, right? Because of how they're written, and I don't think maybe this was their necessary intention, but this is the potential impact, right? Is that if you are wearing something that doesn't align with your expectation on what your gender expression could look like, you could be, punished or get fined under these drag bans. Like if I'm trans and I'm just kind of like walking around, I could be targeted by the drag ban. Or if I'm just wearing like a dress, like I'm wearing like an ugly hoot skirt, whatever I'm wearing, right? I could be targeted by one of these drag bans because I could be seen as a performer in public wearing these whatever lewd things or whatever you want to say. And that's actually true from this ordinance too, when we look at how it's been used throughout history, right? So this was an ordinance kind of really targeting a gendered aspect. But because, right, we talked about how gender expression varies culturally, it ended up targeting or being used against a lot of communities of color here in San Francisco, right? So it was used a lot against Chinese immigrant men, right? Because maybe of the hairstyles they had. Western people thought, oh, only women wear this hairstyle, so you're being effeminate by wearing this hairstyle. It's also was used in the 60s against hippies, right? Hippies who had like long hair, they had other kinds of like clothing maybe that didn't conform to the societal norms of those times. And so that's the thing about these discriminatory ordinances, right? Most often it can impact a lot of people. Okay. Another thing I wanted to cover before we kind of go more into our kind of content section here, and actually after this, we are going to bring up our friends from the Contra Costa Health Services Gender Clinic to chat a little bit about who they are and what they do. But I wanted to talk a little bit about Glide Memorial Church and some different types of early advocacy that were happening. So has anyone heard of Glide Memorial Church at all before? Does that name like, can I see like some hands or thumbs or like some emojis? We see some yeses. I see some nods. No's. No is fine too. You don't have to know, you don't have to know about it. But Glide Memorial Church, it's a church. It will always have a special place in my heart. It's actually one of the most important historic social justice, really, and I use that kind of broadly, but it's really one of the most important sites of social justice, like on the West Coast. And because of what really happened during the 60s when they had a really big change in their kind of leadership, right? They had Cecil Williams, Reverend Cecil Williams. He actually recently just passed away. Yeah, he recently just passed away. But essentially what he would do is he would open up their space to anyone who needed it. And because of how they operated the space and their kind of mentality around, well, if this person needs help, we're going to help them. Or if we see this issue, it looks like they need help, let's offer them our space. But because of that mentality that they had, just really committed to this aspect of social justice broadly as it played out in different communities, it really became a hub for so many different movements. I mean, racial justice, right? But also, different LGBTQ activism. And kind of what I'm highlighting here was some of the different types of trans activism that happened there. Because if I wanted to hold like a support group for people who were gender nonconforming or trans, like there was no space that would let me do it outside of Glide Memorial Church. And so that's why it became this important hub. And just kind of a note too, and this is just a note on terminology generally, right? Is that the terms people use to identify themselves change over time. And that has really drastic implications. There are some words that people use like 20 years ago that you would never want to use now. Like you would not say that word. There are other words where it was maybe a slur 20 years ago, and now it's a term that people strongly identify with. And as you're working with clients, like that's going to be something that's going to be really important to know is that when you're talking about communities who are within this kind of gender, sexuality, spectrum umbrella, the terms are going to change rapidly. And so when someone says, oh, I identify as this, or this is how I identify, right? That's why it's really important to listen to those people because those terms are going to change quickly. My favorite example of that, right, is so like I personally, like I identify as queer, but that is not a word that a lot of people will use, right? That is a word that is a very strong slur to some people. I think particularly on a generational way, right? Like when you go back maybe like 20 years, that was like a very strong word that people were like, oh, I don't like that word because it's a word that was used against them in a very negative and violent way. And so they don't want to hear it at all, right? And so that's why terms and thinking about them in context is important. But side point. But at Glide Memorial Church, kind of going back into the history and advocacy, there was a group, 1967, it was called Conversion Our Goal. And so they offered, community-based support. They had like support groups, they had peer-to-peer like counseling type of stuff, advocacy. They had kind of like some of you actually at your agencies might have advocates who work with clients on benefits or who go to clients to sign up for different things, right? They offered that type of advocacy. And they help with referrals to mainstream resources. They said, hey, if you want to go, get your ID, if you want to go do this, go talk to this person at the gender clinic at DPH. They offered that type of support. Kind of similar to how some of your agencies do it, right? There was another group, National Transsexual Counseling Unit. So this was a group that not only worked nationally, but also actually in a global capacity a little bit. So they were really focused on providing resources, kind of more counseling, kind of pseudo-clinic-y type of services at a community level, right? But they would also mail out a lot of educational materials, right? And these were materials like you literally couldn't get anyplace else. And what's important to remember about this time when they're mailing out all these newsletters and these resources, like sometimes that was illegal. Like sometimes it was a felony for them to be mailing that out. But they mailed it out, mailed it out across the world. And they did it so people could get information that wasn't available anywhere else. Okay, any other questions before I move on? Okay. Okay, so with that then, I am going to pass it to Brooke. And I put your stuff in our slides, so I can just, do you want me to, okay,
That's
I'll
be
share.
great. Thanks, Nick. I really appreciate all of this context that you've provided so that we can move forward, and because a lot of those terms and definitions and history have been part of my previous trainings at other institutions. So I'm glad that you did that background work so I can just focus on our services here at the county. My name is Brooke Parker. My pronouns are she and her, and I work at Contra Costa Health Services at the Gender Clinic. Our Gender Clinic is a monthly specialty outpatient clinic for trans and non binary patients. So we love and accept all LGBTQ patients, though we specifically only treat trans and non binary patients. And we have several locations. Our locations include West County Health Center at San Pablo, Martinez Health Center in Martinez, right next to our Regional Medical Center Hospital, and then also in Pittsburgh at Pittsburgh Health Center. And each of those locations occur once a month for Gender Clinic on different days. So technically, we are caring for patients throughout the month. And we help patients with medication and hormone management. We also help them with mental health care through our county. we refer them externally for procedures because the county health services is mostly focused on primary care. So when it comes to any additional services such as surgery or hair removal, we refer out to clinics for that, though it is covered under our insurance. And then we offer case management. That's my job here at the county. I help with food, housing, transportation, scheduling doctor's appointments, helping with insurance or pharmacy issues, disability, education, and employment. Anything that is non medical in nature, I am in charge of for our patients. And my job is actually relatively new with the gender clinic as a case manager. I started last year in September, so about a year now. And prior to September last year, our gender clinic did not have a case manager. It was only our doctors doing everything, both medical and non medical. And I wanted to offload that burden. So I came on as their case managers. And now we have a wonderful partnership where I am able to meet patients in the clinic on clinic days, as well as have my own desk when I can do other gender clinic related things that do not need medical advice from doctors. And then part of my case management is also connecting to community resources, such as support groups. If patients want to be seen in our gender clinic, they must be 18 years or older. We are trying to expand to younger than 18. However, that takes authorization from many departments here at the county. So it is a slow process, though hopefully in the future we will be able to offer gender affirming care to minors. And then our patients do have to have Contra Costa Health Plan Medi-Cal as our insurance. We only take that insurance for our gender clinic patients. Patients do not need a referral from any provider, though they could have a referral, and that would be through Epic, our online health chart. Or if they don't want a referral, they can just call the appointment line to schedule an appointment with our gender clinic, and I have the phone number here. When it comes to housing data, we do track that in the gender clinic, and that data is recorded during intake with our registration clerks. So we have learned that in the past year, our gender clinic patients mostly identify as not homeless, 76%. And then those who are homeless or report being homeless, 14% of them report being HRSA homeless, and then 9% report being HRSA and HUD homeless. Next slide, please. So I have included some inclusive language that you may use in your own agencies when talking to clients. We are trying to be more inclusive and move away from the gender binary. So instead of mother or father, we can use parent and guardian because there's so many different types of non-traditional families out there that we need to be inclusive of. And then such as husband and wife, we can switch to spouse or partner. For marital status, we can switch to relationship status because not everyone is married, and that's perfectly valid. And then for breastfeeding, we'll switch to chest feeding to include trans parents that are breastfeeding. So we'll choose to use the chest feeding term. And then family history, if that's needed in a medical context, we'll switch it to a blood relatives medical history. For preferred pronouns or name, we are taking away that preferred part because it really isn't an option that we use someone's correct name and pronouns. It is their name and pronouns in their current history. That may change in the future, but as we know them now, what they say their names and pronouns are, that's what we'll use. And then the last one, we have typically used honorifics such as Mr., Mrs., or Ms. to describe someone with their last name attached after that. And like I said, we're trying to be more inclusive outside of the gender binary. So I have heard the term MX period pronounced mix, and that goes in front of a person's last name, just like the others. And that's for any person that does not ascribe to the gender binary. Or you might see MX period on bulk mailings that get sent out to multiple clients because MX period is the most inclusive for everyone. And so an example of this was my mom received a mailer from UC Davis Veterinary Hospital, and it had MX period and then her last name on the envelope and the letter inside. And she immediately worried, oh, do they think I'm LGBTQ just because they used MX period? And I had to talk her down. That's part of my job. And I said, no, they probably used MX period for everyone that they sent this out to because otherwise they would have to go into everybody's chart that they were sending a letter to and see what their name was and assume their gender and put the assumed honorific in front of their name. And so this was an easier way to just be inclusive of everyone. And they used MX period, pronounced mix. So you might see that or you might use it. And then I also included some phrases that you could use during intake for when you're interviewing your clients for what type of housing they might need. So when it comes to sexual orientation and identity, you might say, how do you describe it? So let them use their own words. And then for relationship status, you might say, are you currently in a relationship or how many people will be staying with you? Because you might have to adjust for how many people will be coming with them to be staying in that housing you are looking for. And then just like sexual orientation, you might say, how do you identify or describe your gender? And then I have heard that there have been some safety concerns, whether that be verbal discrimination or physical or sexual harassment in shelters. And so it's always good to kind of bring that up in the intake process and say, do you have any safety concerns that we should be aware of or anything that you would like to address right now? And then take that into consideration later. Next slide, please. Here are some resources that I've included. I frequently give them to my own patients. When patients are in crisis, I always provide them with the 211 number for our county, and that's for food, housing, anything they need in that moment. And that will connect them to the appropriate resource, such as a shelter. They also can call the suicide hotline 988 or the trans hotline specifically for trans people. And then the Trevor Project is specifically for youth. When I refer patients to housing, I always suggest Open House. That is an agency in SF for LGBTQ seniors and those who are disabled that specifically looks for housing and other related resources. And they provide a monthly list of housing options for people. However, just because they specifically help those who are LGBTQ plus and or disabled, the housing list is available for anyone. And then I also help patients find housing by referring them to findhelp.org. And findhelp.org is a great resource that can connect them to community resources such as food, housing, transportation. It's not just for housing. And so clients can type in their zip code and then it will come up with different tabs related to a category that they might search for, and from there they can find those resources. For any HIV, STI information, we do have a great program here in-house with the county health system, and then we also contract with East Bay Getting to Zero in Alameda. If families would like more support regarding LGBTQ identities, we always refer to PFLAG, and they have a chapter in Clayton and Concord. That's a combined chapter. And then also in San Ramon and Danville, that's the other combined chapter. That's for family and friends that want to learn more. And then we also have Gender Spectrum. And then for Spanish speaking families, we have Somos Familia. For other support groups, there's different types in other locations of the county. So for West County, we have the Rise Center for Youth and Richmond Rainbow Pride. For Central County, we love the Rainbow Community Center. They're one of our favorite resources. And then we just started partnering with La Concordia Wellness Center. And they have free and or low cost on a sliding scale services related to mental health specifically. And they are very culturally affirming. And then in East County, we don't have a lot of resources in East County for LGBTQ clients, and that's a real shame because there is a high proportion of LGBTQ patients out there. However, we do have a partnership with the Center for Human Development. And then outside of Contra Costa, we have partnered with Oakland Black Pride and Solano County Pride. Those are all the resources that I have. The last slide is just my contact information. Does anyone have any questions right now? I know I went through that really quickly, and these slides will be available to you. No? No questions? Okay. Thank you so much, Nick.
Great. Yeah, thank you, Brooke. So again, right, if anyone needs the contact information or any of this information after, you will get the slides. I'm also putting together, or I have like a public box link that I put a bunch of stuff in. So not only will you get these slides, you'll also get some different resources. HUD has put out some, they actually recently updated some of their equal access materials. I noticed as I was kind of going on their site that they had like just done it. So you get the brand new kind of HUD equal access resources. You'll get the scenarios and stuff that we're going over later. And in the scenarios that I put in the box folder, it has, you know, explanations and sample answers and stuff too. But you don't get that yet because we have to go through them first. Okay. But with that, the next thing we are going to cover is the actual equal access rule. So kind of two things that we'll be focusing on here, the equal access rule itself, and then there's another kind of related, kind of connected aspect about family separation and how families are defined through HUD. And so all of this, when you're looking at all of this, just remember too, if you're, you know, a CoC funded provider, it doesn't just apply to you. This applies to all of the CPD programs. So if you do like, what is it, like HOPWA, CoC, if you get ESG, what is it, the home one, like CDBG, you know, all of those kind of community, basically the money that HUD can give out that could be potentially used on housing, homelessness related things, it would probably apply to your program. And then as we're talking about this in the equal access rule, also remember that California has more expanded connections related to kind of fair housing and public accommodations than the federal government does, right? So that's also kind of context here. But with that, I'm going to pass it to Riley to talk about what the actual rule is.
Yeah, thanks so much, Nick. Yeah, so we're at the point of our training where we're more getting into the nitty-gritty of the actual HUD equal access rule, but I hope you all really appreciated the foundational language and history context that Nick provided and getting to hear a little bit from Brooke about resources available in the county. So yeah, we're going to talk about the HUD equal access rule, which basically requires equal access to shelters and programs in accordance with someone's gender identity without regard to their perceived sexual orientation or gender identity or marital status. So noted that in our poll at the beginning of today, most of you noted you were a beginner or you were at the level where you're still looking to learn more. So just want to remind you all that feel free to ask questions at any point, and also you can ask questions following up with Homebase after today's training too. So here to help you learn about this rule, and we're kind of learning together. So I'm mainly facilitating this section, but Nick is kind of our resident expert of equal access at Homebase, so he'll be jumping in as well, just to share some best practices and guidance. But welcome any of you all here who's doing this work to implement equal access to jump in as well with your kind of experience and expertise as we're having these conversations. So yeah, the equal access rule first published in 2012, but it was most recently updated in 2016, and this has been a final rule, so it's here to stay for the foreseeable future. And so, yeah, I mentioned already, but we'll repeat again, like what exactly does this rule entail? And it's that it requires access to shelter, housing, and services for individuals that are provided in accordance with that individual's gender identity. And have some key points on the slide about that. Just basically that Nick already mentioned this, that this rule applies to all community planning and development programs. So if you're a CoC funded project or just funded by HUD in any other way, this rule is going to apply to you. So assuming most of your organizations that you represent on this call today, this rule applies to you. But irregardless, this rule is still best practice for anyone working with people experiencing homelessness, even if you're funded totally by donations, this is still best practice to make safe and inclusive spaces for your residents. And so when we say someone is placed in accordance with their gender identity, that is referring to the gender identity that an individual declares themselves, not what is their perceived identity. So we have a slide later to kind of help differentiate that. And then it's important to know, we're going to talk a little bit about there can be no requirements for an individual to prove what their gender identity is. So that means no documentation or examinations to kind of determine what an individual's identity is. That comes from themselves. And then lastly, you all may be familiar with this, but your organizations do have to update policies and procedures to reflect this new rule. And I think we have some slides with resources. And as Nick was talking about, we have this public box folder that have resources in there as well. So you can kind of see some HUD materials related to this.
Yeah. And so when HUD monitors, for example, right, like if you are the lucky program that gets selected for HUD monitoring, one thing that they will do is they will look and see if you have the different policies and procedures that are required for some of these different programs, right? And so some of that is going to be relating to equal access. And so if HUD monitors your program, maybe they'll look through your client files, maybe they'll look through your other documentation, record keeping stuff. But they're also going to ask you, hey, can you send us these policies? Hey, can you send us maybe different things relating to accommodations? They're going to ask for that. And they're going to be looking for references to this here. If any of you are involved with coordinated entry, if you have like a coordinated entry committee or something like that, you probably have some kind of little paragraph or something in there referencing equal access as well, too.
Yeah. And this, thank you for that context. And yeah, ask any questions about that if you have them. So wanted to just kind of talk about some of the key tenets of the 2016 equal access rule, and just emphasizing again that this rule clarifies that gender identity is wholly self-identified, and it is separate from legal gender or identity documents. So this means someone's self-identified gender is irregardless of whatever their sex assigned at birth is. So what is on a birth certificate doesn't matter how you perceive them, doesn't matter, and how this rule is implemented. And so we've already kind of talked, Nick already talked about kind of these foundational concepts of gender identity versus sex assigned at birth. And so what we can take away from this that HUD is telling, it's programs that it funds, that equal access is really advocating for client choice in programs. It's an extension in a way of housing first, so it allows a client to voice their needs regarding their gender and subsequent placement in a program without any barriers whatsoever. And by removing intrusive questioning or requests for documentation about gender, that is, keeping the client comfortable, again, without any barriers to prove what their identity is, other than saying this is what I identify as. And so we can move to the next slide, I think. Just more about like why this rule is really important. So trans and gender nonconforming individuals are the most likely to receive services not in accordance with their gender identity historically. So this rule is really going to help protect their privacy and validate their gender identity, as opposed to cisgender clients in the system. And transgender and gender nonconforming people experience some of the highest rates of homelessness of any subpopulation. So we have some stats from the 2022 US Transgender Survey that you can see here, just kind of understanding their impact. So 48% of those who saw a healthcare provider in the last 12 months reported at least one negative experience. 30% had experienced homelessness in their lifetime. 9% reported they were denied equal treatment or service in the last 12 months because of their gender identity or expression. And those experiencing homelessness are disproportionately LGBTQ+, especially in the youth population. So there have been many such cases where shelters have not been willing to house transgender men or women in alignment with their gender identity. For example, that could be like a transgender woman has only been offered to shelter alongside men, or instead of women, or they were maybe refused service altogether. So this rule is trying to stomp out those experiences of discrimination.
And this survey, so this is a national survey that's done. It has several thousands of it's the largest kind of survey of its kind that's done. They last did it in 2015, so this is the 2022 version. I took this data from, they released kind of a summary report. And so eventually they'll have a much more kind of detailed report that they do. Last time they also did it by state, so maybe they'll do it by state again this year, I'm not sure. But it has a whole bunch of information, and one of the sections is kind of like, they have a housing section, they have like an economic section, they have a whole bunch of, they have a healthcare section, a whole bunch of different different kind of areas that they cover. These are just like a few of the stats that I just kind of pulled out and immediately saw. I put the summary report in that public box folder, but just also know that in the future, there's going to be a much more comprehensive version that's going to come out, and it's probably going to be pretty relevant to a lot of the positions that you're all in. So just giving that a plug.
Yeah. And data on this population can be hard to gather. So this national survey is like a really, really great resource. So keep your eyes up for it. And we already mentioned previously about how this rule requires programs to update their policies and procedures. So here's kind of a summary of what needs to be included in those documents, things that HUD is looking for. In your policies and procedures, you must kind of be ensuring equal access to programs for all individuals and families, providing housing services and accommodations in accordance with a client's gender identity, and then determining eligibility without regard to actual or perceived sexual orientation, gender identity, and marital status. And so we know that just because these are the tenets that are in a policies and procedures document doesn't mean that implementing this is easy, just because it looks easy in these 3 sentences. It can be hard to do this work, and that's why we're gonna hopefully have some time to run through scenarios and breakout rooms for y'all to kind of like relate on challenges and troubleshoot together what this actually means in practice. And so equal access definitely has more implications for policies at congregate shelters or housing programs with kind of shared communal spaces and bathing areas that may not originally be unisex. So just want to call that out, but equal access has implications for all programs, just more so when shared sleeping or bathing comes into the picture. So equal access should create policies that allow for placements for sleeping and bathing to be made based on an individual's gender identity that they share. So if there are issues with other residents, other program participants, the providers must take any non-discriminatory steps to address those concerns raised by other residents. So if shelter residents are concerned about sharing a space like a restroom with transgender or gender nonconforming participants, certain policies can be adjusted to address these conflicts so long as the solution isn't to fully isolate or segregate the person that's identifying as trans or gender nonconforming. So this might look like creating like gender neutral spaces for showers or changing areas for those that want more privacy. And then the last point there was just that these policies need to be updated to ensure compliance with HUD. So a little side note is that, this rule, it's just important for any program or service in the homeless response system to create safe spaces for all residents and serve people in alignment with their gender identity. So Nick already gave a definition of gender identity earlier in today's training. But now that we've introduced this equal access final rule conversation, we want to just talk about what gender identity means in implementing the rule. So there are 2 ideas here on this slide. The first on the left is the gender someone tells you they identify with, and then there's the gender you may perceive them to identify with. So I'm telling you this is my gender versus you telling me what you think my gender is. And then the perceived gender identity on the right side, that may be influenced by your own biases based on like how you view someone appearing, dressing, and acting. And so the equal access rule amended HUD's definition of gender identity to really clearly reflect this difference between someone's actual gender identity and the perceived gender identity to make sure people are getting access to services in accordance with what they say their gender identity is. And there may be their actual gender identity may be different than the gender or sex listed on any individual's documents, and those documents aren't meant to determine a person's gender identity. It's simply what someone shares and report their gender as. So on the next slide, this is just a reminder again that I mentioned at the very beginning that intrusive questioning is prohibited under the equal access rule. So providers are not to ask any questions to confirm an individual's gender identity. So it's solely based on what the client shares. So this means your organizations shouldn't be kind of looking at documentation, physical or medical evidence to contradict what someone says their gender identity is. There should definitely be no anatomical examinations or asking for that anatomical information from clients or looking at medical or physical history. So at this point, this is kind of, we're going to go into some best practices about the equal access rule, but this would be a great place right now to ask questions about what we've just shared. So feel free to raise your hand or put things in the chat.
Okay. Yeah, any questions from anyone? I think for these next slides, we have best practices kind of divided up by different kind of areas of the coordinated entry system, if you will, or maybe different types of tasks. But I think we'll go through, I'll do this very quickly so we can get to the family separation part. Maybe I'll just highlight like a thing here or there so we can also get to some of the scenarios. But if you have questions, feel free to pop them in the chat or come off of mute. But kind of, I think maybe I'll highlight some on each of these. But I saw we had a lot of kind of outreach staff, a lot of people at shelter, congregate facilities, day centers. But when you think about some of these initial moments, right, that Riley was talking about when you're doing some of your intake paperwork or you're doing your enrollment, like those first moments of how you engage with that person are going to matter so, so much. Like if someone tells you their name is Sparkle, you go with it. Just go with it. I literally had that happen to me once. Someone was like, "Oh, my name is Sparkle." I'm like, "Okay, Sparkle. I'm going to write Sparkle down. How do you identify Sparkle?" But even that thing, like whether their name was or was not Sparkle, I have no idea. But that initial part is basically a test, right? They are testing you to see like how comfortable you are going to be with them sharing private information with you. And that is a relationship building exercise. And you can think of that as you're collecting all of this initial information, right? Like this is a relationship building exercise where you are being tested in how are you going to be able to handle the private information that they are sharing with you, that they are entrusting with you. And for some of this information that you're collecting too, I think the number one thing I talk about is IDs. There are so many times where I see a project or a program or something that's requiring your government ID when they don't have to, right? Like when we do monitoring and stuff through home base for different projects, we're like, oh, why did you collect this? Or why do you have to have this? And so many times a project thinks that they have to collect an ID when they actually don't, right? And just that applies kind of broadly, right? Because I think, for some of you who may work with people who are experiencing homelessness, right? People lose their IDs all the time. I lost my ID last weekend. Like if you asked me for it, I would not have it. And so just the ID in itself can be a barrier. And if you don't need it, don't have it, right? Same thing during enrollment, right? When you're kind of enrolling the person, asking the person about their identity. And we'll get into this kind of later with the scenarios, but if you have facilities maybe that are sex segregated or something like that, right? You can ask someone like, oh, well, we have this and this available. What would you be more comfortable with, right? It can be as simple as that. Same thing in unit bed assignment, right? Like we have this available. What would you be, comfortable with? But it also means when you're talking about kind of actually working with units, finding folks finding folks beds, different facilities, it's going to mean you're going to have some conversations with people, right? You're going to have to talk about maybe there's an incident that came up, right? And a lot of times people get kind of flustered by this. Well, what happens if there's harassment? What happens if there's sexual harassment? What happens if someone goes into this bathroom or all of that? But I think the thing to remember is like all of your programs, you're going to have policies about harassment. You're going to have policies about sexual harassment. Like those are going to apply whether it's a man or a woman. And so what you can go back to is well, we have this policy that talks about physical harassment in this way. That's going to apply to anyone. Same thing goes for sexual harassment, right? We have this policy that's going to be defined in this way. That's going to apply to everyone. Let's see. And then we have a question in the chat. Could an intrusive question be, what is your gender? What is your sexual orientation? Which are two common questions asked on most intake forms. I think generally that's going to be fine, right? I think, usually you just ask someone, how do you identify this? How do you identify that? I think that's very, very standard and very common for intake forms. I think just the thing for you to remember with any information that you're collecting is like, do you need it and is it useful, right? If it doesn't kind of pass those two questions, then I would say you don't need it, right? Like I like there, that's why I get when I get those like, oh my God, those stupid targeted advertising, surveys and they want all that information. I'm like, you don't need this. Why do you want this? You don't need it. And so if it doesn't pass that, if you're like, do I need it? Do I have to have it? If it doesn't pass that, take it off. Okay. In ongoing services, right? This means, you work with the client in whatever kind of services, whatever kind of facilities that they are eligible for. It means if you have to have a conversation about safety or risk, right? Having that conversation, whether it's with the client themselves, whether it's with someone else who is kind of causing that or kind of facilitating that kind of safety or risk situation, especially when it kind of comes down to verbal or physical harassment, right? And that's when you go back to what are the policies that your agency has about different types of harassment, right? Because those, again, will apply to everyone. And then culture, again, we talked about this a little bit, but right, you're going to have policies and procedures that are going to reflect what's going on. You're going to have trainings like this one, and different trainings at different levels, right? You have expectations that get communicated to clients, right? That's kind of like, maybe when you're doing your kind of enrollment or kind of, oh, so you're welcoming someone into your shelter. You're like, these are the rules that we have in our shelter. These are the rules that we have for using our common spaces or whatever, right? Kind of going over what those expectations are with everyone, right? You have the day-to-day interactions, that's going to be if you, accidentally misgender someone, just say, sorry, move on, kind of, correct it. And you don't have to make like a big deal about it, right? Okay, and now real quick, we're going to jump into the family separation portion. I'm going to pass it back to Riley.
Yeah, so equal access has some implications for how we define family when serving households experiencing homelessness. So the way that we traditionally think about family, like blood relatives, doesn't necessarily match how other individuals' households, like LGBTQ households, might define family. So yeah, in this case, you can just think of family um, as a household. And so under equal access rule, it defines family as either a single person that can be um, any type of person or a group of persons residing together. And so a group of persons residing together can look like a lot of different things. And we have some possibilities listed here, but there are many other examples as well. So family could look like group of people with or without children, an elderly family, near elderly family, a family with some members with disabilities, a displaced family. So it's really just simply how the clients you're coming across define who is in their household, who they're residing with, and who they want to um, receive services with. So on the next slide, we kind of want to talk about what this means for shelters and your programs. So a group of people that present together for assistance and identify themselves as a family regardless of age or relationship or any other factors. And a family should be served together regardless of how they present if they're not that traditional family structure with a couple with children. And providers need to be able to serve every kind of family, regardless of age or sex of the adults and children. And involuntarily separating families based on the gender or age of their minor children is a violation of HUD regulations. So this is something that is kind of tackled through the coordinated entry process, a lot of times before these households are reaching your programs. And we have some examples here of what it means to prevent family separation. So a shelter cannot separate teenage boys from their families. A program cannot separate out or deny assistance to adult men that present themselves as part of a family. That could be the father, the uncle's mother's boyfriend, because that has historically happened a lot. And a shelter or housing program may limit assistance to households with children. It may not limit assistance to only women with children. So that is what that's saying there is that housing programs and shelters can serve specific subpopulations, but it may not limit assistance to only women with children. If there are two adults presenting together as a family for housing, you should serve those two adults as a family and may not require proof of marriage or may not limit assistance to couples that are not in a heterosexual relationship. So not limiting assistance to same-sex relationships. And a housing program cannot reduce size of a family because one child is in foster care. So I think some of our scenarios might get at these topics of family separation, but want to just ask now if anyone has any questions. I think we have a few more slides actually before we move to scenarios. I'll cover those first. Just with some more information about how to accommodate families, because your current policies and facilities may not be currently built for serving households. So here's just a few examples that maybe I won't read over all of them, but you can look into them after today's training, just that if a shelter has a private room in which a family can stay together, then the family must be able to stay in a room together if they choose. If the standard practice is to put mats down in a conference room for everyone who is considered overflow, then it can shelter a family together in that space. If the standard practice is to place a family in its own room, it would be acceptable to leave a bed empty to accommodate the family. And if a family presents for permanent housing and one child is in foster care, it would be acceptable to house them in a larger unit and document it is necessary for family reunification. Yeah,
And some of these questions too, are some of these kind of scenarios tie into HUD's definition of household, right? And so I think maybe if some of you have worked with HUD programs, right, you know that there's always like an exception for everything and how HUD defines something. And some of these scenarios can get very specific, but if you do have questions, you can feel free to like email us too, and we can work through any of those like very specific kind of questions. I see there's something in the chat and a hand here. Let's go with Jacqueline. I think it's Jacqueline. Okay, I'm gonna stop.
I'm actually using someone else's invite to be able to attend the meeting. This is Nicole. So I have a question. So in a shelter, for example, we if there are like family suites, right? If there's family suites that accommodate just the mom and her children because it's in a women's dorm area, the men have to be in the men's dorm. But what if the child reaches a certain age, like the boy? Like I think here it's like 12. If the boy is past 12 years old, they're no longer able to be in the family suite because the suites are connected with another suite. Is that violating anything to say, hey, because your child is this age, because there's another family right across from them. So if the boy is 16 years old, it's kind of like making the other family that has children. I don't know. That's I'm just trying to have a better understanding. I personally I have had some issues with it, but I just want to see how does that if I were to address it, how would I address that?
Yes, good question. And I think that might actually tie in with what Vicky is asking here in the chat. Vicky's saying there are a couple of family shelters in East County that only allow women and children. Is this a violation of equal access? And for that, what it ties into is where does their funding come from, right? So again, the equal access rule is something that applies to, a lot of these HUD funded programs. Also, if they get, certain state funding, and I would imagine even if they get some of your kind of local funding too, oftentimes local contracts will have some kind of, non-discrimination clause or some aspect of this that's also related to that. So if they get, some of these different, sources of public funding, right? Equal access or some version of it would likely apply to them. CoC funding, right, as our Contra Costa host here is saying, doesn't apply to shelters, but ESG funding does apply to shelters. Some shelters do get ESG funding, like in San Francisco here. I know some of the shelters are funded through ESG. And so then equal access would apply to those facilities, right? If it's like a facility that's completely operated on private funding, right? There are some facilities, maybe it's like a religious kind of shelter run by a church, and they have, you have to go to their services, you have to go to their classes and all of that. But if it's entirely privately funded, they're able to do that. And so that's why for specific shelters, I can't necessarily say like, oh, can they do this? Yes or no, because I don't know how they're funded. It ties back to the funding. But in terms of equal access, right? Again, one of the core aspects is going to be that client choice aspect. How the family is presenting themselves is like you kind of accept it and take that as their word. You're like, okay, you're a family, you're a family. Okay, like this is how you identify, this is how you identify, right? And so you kind of take those kind of at their word. So yeah, I know, I'm sorry I can't speak to that kind of specific facility, but in terms of how they're doing placements, right, it would have to be in accordance with how the family is kind of presenting themselves, and then the aspect of how they're identifying themselves. Does that kind of make sense or answer your question, at least like
It
in some
it
capacity?
it makes sense, and
Yeah.
like I'm just like looking at like a bigger view, and I'm like, okay, somebody's already in a family suite, and then because your child just turned 12, right? Like now your family is the family can no longer be in the suite. And I'm just like, it's like the child's not even technically a teenager yet. Like he's 12 years old just because he's a boy. And because I understand that there's another family across that had young children, but I just feel like we're making it seem like because it's a boy and it's a kid. You know what I'm saying? Like it's a
Yeah.
child. Like it's not even like saying the boy's 17 and there's another family, a mom and her young children there. And we're trying to make it, separate it to make everybody feel comfortable, but 12, 11,
Where
come
does
on.
that come from? Yeah. Yeah, off the top of my head, I'm not sure what would cause that age limit, or if it's something that is kind of just they decided on their own. Maybe it's their own kind of policy that they decided. I mean, nothing off the top of my head would kind of define that age limit in that way from like a regulatory standpoint. I mean, I work with HUD programs, so nothing within the HUD realm. But yeah, I don't know. That's all I can that's all I can give you there. Sorry.
No worries. Thank you, though.
Okay. And so let's do this. So now we are going to go into breakout rooms here. So what I'm going to do is I'm going to create several breakout rooms, and I'm going to ask you to join the one that you feel is most relevant to you. So it looks like we have about 90 folks in here. Let's see. And we have, let's see, a lot of outreach folks. So let's see, maybe we'll do 7 break. I saw a lot of people put other as like their facility type. What are some examples of people who put other? Are you like healthcare kind of folks? Are you clinicians? Can I hear from some people just so I know like maybe where we should help sort people? Nurses? Is it some nurses? Desk clerk? Okay. Okay. And so let's do this. I am going to create 7 breakout rooms here. I'm going to name them. We'll have 2 for shelter day centers. Let's see. 2 for shelter day centers. Then we'll have we'll do 2 for like shared facilities. So that's if maybe you have a transitional housing facility, maybe where people have like separate rooms or something, but a lot of shared common areas. And then we'll do kind of scattered sites. So that might mean you know, your clients are all out in random places, but you know, you still work with them, have relationships with them, but maybe they have like landlords that you're working with. And then we'll do two for like, we'll just call it broadly healthcare. I don't know how like much that's gonna, or let's see. Yeah, we do have a lot of different areas. Okay, so we'll do one. Maybe we'll do how should we call it? Maybe client management. Maybe does that make sense? But aside from that, it's actually really cool that you all get so many different types of roles here. And so many different like sectors. That's actually a really valuable group of folks that you have coming together. Okay, so I am opening the breakout rooms now, and what I am going to do, Riley and I are going to go between them. But you should just see a kind of pop-up that came up showing you what the different breakout rooms are. But before I'm going to put, actually, let me give you the link before you, I think some folks already went, but this is the link. So go ahead and hit that Google Doc link there. That will take you to the scenarios. I think pick two scenarios that you think are relevant to the type of project, facility, work, whatever that you do, and kind of go over those in your groups. But now I'm going to ask you, go ahead and join those groups. So there's two for your shelter day centers, shared facilities, there's a scattered site, health client management, health clients management. I accidentally did it plural. So I think maybe outreach staff, if you want to go into the kind of client management one, or one of the client management ones. Does that make sense? Does anyone have any questions on that? I'll hang out here, but then I'll kind of go and pop in between the different rooms. But you have the scenario, so we'll be going over those, and then we will come back for the last moments and check in. Okay, I see people popping in. People are popping in. Let me.
You see some
Hey,
questions?
Nick,
Yeah.
Yes.
this is Ronald. Will I be assigned a breakout room or how do I get there?
Yeah, so how you get there. So on your toolbar on the bottom, do you see kind of where it says like mute and like turn your video on and off and chat and all of that?
I do. I see audio, video,
Yes.
participants, chat.
If you go to the right, you might see one that says breakout rooms, or you might see like a little circle with three dots that says more.
There it is. I see it.
Yes.
Join breakout room.
Yes.
Thank you so much.
And see educational employment specialist working with folks in unstable housing. I'd say maybe that let's do the client management one. We'll say that's kind of more case management-y
I had a
related.
question. I'm not able to raise my hand for some reason, but is there a certain amount of people you want in? Because you have like two shelter day centers rooms. So is there like a certain amount you want in each room, or does it matter?
No, I think maybe just like try and even them out. Yeah.
Yeah, because one with the health client management, one has 13 and the other one has 6. So I don't
Yeah.
know to split those up or whatever, but
Yeah. I think I'll probably like go in and out. Yeah, and we'll see if we need to redistribute.
Yeah, you can choose, maybe if you're like split between some options, like just choose whatever you're most interested in today. You don't necessarily even have to have, doesn't necessarily have to match your role, just whatever you're most interested in talking about today.
Okay. And you want to hang out here real quick for a sec, Riley? I'm going to pop in and out, make sure everyone is getting started okay.
Mhm.
Okay.
Anyone else remaining need help joining a breakout room? I can assign you if you're having trouble with Zoom.
I'm just over here assigning people, Riley. So folks that are on like the H3 side, like you can hang out here, but yeah, for a couple people, I'm just assigning them.
Thanks. Hey, Polly, did you have a question? Did you just come out of a breakout room? Oh, you're muted. Sorry, if you're trying to talk to us, can't hear you. Might be talking to someone else.
All right, Riley, I assigned everybody. Not everyone has joined, but everyone has been assigned.
All right. And for those just joining, we are doing a breakout room activity right now. So if you're able to join, I can explain to you how it works. But we have breakout rooms that you can assign yourself to based on kind of what your role most aligns to. I might start popping into some of the breakout rooms now to help out Nick. But we'll probably be coming back around
I'll hang out here just in case.
11:55 maybe.
Perfect. Sounds good.
thanks all for staying on with us for just, I think we got to give it 30 more seconds for everyone else to come back. But appreciate you all
Yeah,
doing
I
this.
know those like the Zoom, return to the main room thing is always like very abrupt and very like shocking. I feel like there's not a good way to do it. I tried doing the little broadcast thing where I gave the 5-minute warning, but I feel like the broadcasts are so easy to miss, the group messages to everyone. But we have a few minutes left here. And so in those few minutes left, I wanted to see if anyone had questions about anything that came up with any of those scenarios. Anything you kind of want to chat through as a group together?
We actually use scenario number 12. And a lot of us, at first we talked it out and was just like, hey, we should definitely educate the owner that they probably shouldn't be saying that. But they have housed multiple people for us. So we don't want to keep the client in a hostile environment. So we would look for another place for them. But also just educating that owner. And then we did go as far as Googling to see if we were right that it wasn't legal. And we Googled that and we got the section code and everything like that just to make sure. But yeah, that's just what our group talked about. Scenario number 12.
Yeah, I know. I think in my mind, some of those landlord scenarios are probably the hardest, right? Because you need their places that they're offering, right? But at the same time, like you have to try and push them to do a little bit more or to like just comply with the law, right? I know, like, oh God, even when I was like looking for the same thing, when you're a tenant looking for a place, when you see something in a listing, you're like, that's illegal. Like, you can't do that. Navigating that conversation is so hard. But I think, even just relating to, and this goes back to what, maybe some landlords are asking for you too, right? A lot of times, like through the conversation with the landlord, I think most of the times you can get rid of some of those things, right? Like I've seen so many scenarios or instances when it's like, oh, the landlord wants us to give their government ID and blah, blah, blah. And like a lot of the times is like, if you're a housing navigator or a program, this can be where you get to like, talk up your program, all the things that it offers and be like, well, would you consider that we offer this and we're going to do these check-ins with clients and we do this, this, and this? Like a lot of times that can be how you can convince a landlord to, get rid of some of those requirements or be willing to accept your tenants, right? Because as a housing provider, me as a tenant, I don't get like a monthly counseling service that's making sure I'm stable, making sure I get I have to do that on my own, right? But you can guarantee that that is something that that person you are trying to put in that unit is going to get. And so part of it is like, how well can you sell and talk up your program? But yes, a very tricky situation. Any other kind of questions or things that came up for people? And one thing I'm also going to put in the chat here before everyone heads out, and I think, maybe we'll have our Contra Costa friends send out like this link or something to everyone who registered, but I just dropped it in the chat here. This is a box folder where we have just the slides, where we have extra resources as well. And so HUD actually has an equal access, kind of like a toolkit. And so if you are someone who's like in leadership or in management or something, this toolkit, there's an assessment in it and it will ask you, oh, do you have this policy or do you have this or how do you deal with this scenario? Like it has a basically like, what do they call it? They call it they just call it a self-assessment or something like that. But you can go through and this can be like a really great follow-up stuff for you too. But any other questions or anything else that came up for people or folks? I know we're kind of towards the end of our time, but I'll stay on a little bit if people have like questions. Okay. But it is 12 p.m. So if you got to go, you got to go. I can hang out a little bit if people have questions. I don't know about our Contra Costa person hosting the Zoom. I don't know if you have to go immediately after this. But I'll just stay a little bit if anyone has questions or things they want to talk through.
We
Thank
actually
you.
do. I'm sorry, we have to take over the
Oh,
Zoom.
okay.
Yeah,
No,
but
it's
Nick,
okay.
would
It's
people be
fine.
able to reach out to you if they have questions?
Yes. And we will send that in the follow-up email that we work with you to send out because I think a lot of people have left.
Thank you. I sent you all the survey link if you can take that. And then, yeah, Nick and Riley will be sure to send out the materials to all of you who attended. And if you registered but weren't able to attend, you'll be on the list to get all the materials.
Okay, great. Well, thank you, everyone.
Thanks so much, Home Base. Thank you.
Thank
Bye,
you.
everyone.
Bye.